Hi everyone, my name is Allison Mukasey. I'm a fellow AMFT here at Embracing You Therapy. In my last video, I discussed what BFRBs are and the 3 common body-focused repetitive behaviors there are, such as Trichotillomania, otherwise known as hair pulling, excoriation, otherwise known as skin picking, and nail biting, amongst a couple of other ones. So for this video, I would really like to focus on treatment modality that we use here in Embracing You Therapy, which is known as the COMP-B model. So just to back up a little bit, one of the main forms of treating BFRBs is under the umbrella of cognitive behavioral therapy. So like I just said, under that umbrella of cognitive behavioral therapy is the comprehensive model for behavioral treatment, again known as the COMP-B model. So what this model does is it identifies the function of the target behavior, so the hair pulling, skin picking, nail biting, and it creates a target replacement for it. And it does so by assessing 5 functional domains, otherwise known as the acronym of SCAMP. So S stands for sensory domain, C stands for cognitive domain, A stands for affect domain, M stands for motor domain, and P stands for place domain. So starting with sensory, we are assessing for any visual, auditory, tactile, oral, or olfactory experiences that occur before, during, or after the BFRB that promotes the engagement of the BFRB. For cognitive domain, cognitive is just another word for thoughts. So here we are assessing for the thoughts that lead to that behavior. So what caused it, what cued it in a way. For affect, affect is another word for emotions or feelings. So here we're keeping track and we're assessing I guess what emotion is causing this individual to do a BFRB. So a lot of times BFRBs are done as a way to regulate emotions such as nervousness, anxiety, frustration, even sadness. And a lot of times after the BFRB, people will experience, sometimes it'll be satisfaction. Other times it could be guilt, sometimes even shame or embarrassment. So moving on to the motor domain. Motor domain captures the person's awareness and ease of engaging in each BFRB. So awareness is huge. And I'm gonna get into different worksheets that we use in order to, again, assess and come up with an action plan. But awareness is huge for addressing all of these domains. The key here is let's keep your hands busy, or let's just make it a little more difficult to engage in these BFRBs. So the last domain is place. So place encompasses our environment, current location, time of day, the activity that promotes the BFRB. So now that we know what each domain is, I want to just again circle back to the worksheets that we utilize here in our practice. So the first worksheet is called the self-monitoring form. And the self-monitoring form is really cool, as in whenever you can catch yourself doing a BFRB, it helps you keep track of, okay, what domain was it a part of? Was it sensory? Was it cognitive? Was it affect, motor, place? And it has you write down what the situation was. It even helps you track your awareness to how often you pull hair, how often you pick at your skin or bite your nails. So once that self-monitoring form is completed, then we move into our action plan. And our action plan, think of it as interventions, tools that we use to, again, redirect that behavior and change that behavior, or just make it harder to do. So a very common example would be, let's say if someone is struggling with pulling their hair, a very common example would be, see if we can put gloves or wrap a band-aid on your finger, because that's going to feel different on your fingers, on your senses, than it would if it was just your bare hand. And basically, we go through our self-monitoring form to complete our action plan. So again, whenever there's a self-monitoring form, there will always be an action plan. If this seems something that is one very interesting in terms of, hey, what if I have a BFRB and I'm not sure, or I actually want to learn a little bit more about how to self-monitor and what this action plan is, we would be more than happy to help answer any questions. And it's something that I love to guide my clients with, so that it becomes something that isn't so daunting or overwhelming. It becomes something that can be a place of, or just a sense of empowerment. So once again, if you have any questions, feel free to subscribe. I'll be doing another video on BFRBs, specifically with how to talk about it with your loved ones or with friends, and how to seek out support. So if you have any questions, feel free to call our office. We'd be more than happy to offer a 15-minute consultation. We'll be more than happy to also answer any questions in our comment box. Hope you all have a wonderful evening.